patient nears the end of surgery, verify with the doctor that it is time to shut off the isoflurane, but leave the patient connected to oxygen for 3 to 5 minutes. When the doctor is completely finished with their surgery and sterile field, administer any remaining vaccines. Ensure the patient's blanket is clean and dry for recovery. If soiled or damp, place a fresh blanket on the recovery mat for them. Disconnect the patient from the anesthetic circuit and shut off the oxygen. Then place a reservoir bag on the end of the F circuit to contain the waste gas. Next, deflate the cuff of the endotracheal tube and check the patient for a palpebral response. If the patient blinks after stimulation, gently pull the tube before you transport the patient to recovery. If there is no blink response, keep the tube tied in, which will help keep the tube in place during transit. Gently pick the patient up, gaining assistance for larger dogs. Support the head and neck, keeping the cervical region in a straight line, and also the back and hindquarters. Carefully place the patient in lateral recumbency on the recovery mat, keeping her head in slight extension and pointing towards the prep area for easy observation. Keep her head, feet, and tail all within her own blanket to reduce disease transmission. Place rice bags around her, but only on the outside of the blanket. No warming devices should ever be placed directly against a patient's skin or fur. Untie the string or whatever else may be holding the endotracheal tube in place, so it may be easily removed when the patient is ready for extubation. Apply a dose of Karo syrup to the gums. This is important for pediatric, small, and otherwise more fragile patients to help prevent hypoglycemia. At this time, subcutaneous fluids, microchips, or anything else as directed by the doctor may be administered. Our recovery mat is carefully heated with an electric blanket as a bottom layer. On top of that, 1 or 2 layers of heavy blankets or comforters are placed to prevent an animal from overheating or being burned. While frequently monitoring patients, prepare the area for the next surgery. Remove the sharps and instruments and place them appropriately in either the sharps container or instrument bucket. Place all laundry in the laundry baskets. Spray the table and tray with the detergent and disinfectant combination product and let stand. Wipe just before the next patient is ready to be moved into surgery. All staff members in the suite should be frequently glancing at and physically checking the patients on the recovery blanket, and the number of recovering animals still intubated should be frequently communicated. A patient is ready for extubation when the palpebral reflex returns, which is an early indicator that they are waking up. Gently remove the endotracheal tube before the patient can feel it to prevent sudden arousal, coughing, or movement, which can be painful and possibly traumatize the throat. The endotracheal tube should be slowly pulled out without veering to either side of the mouth and following the curvature of the neck. Any patients recovering more slowly than expected should be attended to immediately, and their heart rate, respiratory rate, and temperature should be communicated to the doctor. When a patient begins making frequent attempts to move, become sternal, or get up, she should be taken to her cage. Both blanket and cage should be inspected to ensure they are clean and dry, and the patient should be placed comfortably in the cage with her head facing the door. Staff entering the kennel for whatever reason should observe all other animals. To alert other staff, place a large laminated sign on the cage door of any animal that has health concerns or that may have experienced abnormal events. Check patients frequently. When they are well awake, offer them a small amount of food and water. Clean cages promptly anytime they become soiled.